Okay, so Charlie, recently there's been a rise in heart problems in younger people. And what are your thoughts on starting screenings earlier on in life?
Yeah, I'm very keen on it actually, because every year you read about some poor young kid who runs onto a pitch and collapses and dies, and it's tragic. And in Italy, actually, they do screen anyone who does extreme athletics. They do a heart tracing. Now, what we know is some people are born with a structural abnormality of the heart, but you wouldn't know about it until they exercise, and that's called hypertrophic obstructive cardiomyopathy, or HOCM for short. And you remember David Frost, the famous interviewer?
Yes.
Well, his son Miles very sadly died after going for a jog. He was about 35, he went for a jog and he didn't come back, and it turned out, had this congenital condition. So again, we can screen for that, and certainly in Premiership football and things like that, they do tend to screen for it. There's other things that are abnormal, such as electrical activity, and if that's wrong, then your heart can suddenly start beating super fast, and unless you're given electric shock, then that can kill you. Something similar to that happened with Patrice Mwumba, the footballer.
Yes.
Now, what we do know is we can screen successfully for that as well by doing a heart tracing. And there's a fairly interesting condition called the Brugada syndrome, which was discovered by 3 medical doctor brothers. So, and they're very major contribution to science. And what they showed is if you have this particular ECG change, you're more prone to these fast heart rhythms and you'll need a pacemaker.
Okay.
So Ian Botham, the cricketer, set up a charity called CRY, which stands for Cardiac Risk in the Young. And what CRY does, it goes into schools or communities and offers all the children a heart tracing to indicate any evidence of early heart disease. So I'm a great supporter of that principle and that idea, and I think that personally all of our young children should be screened with an ECG to detect those who have the early indicators of these conditions.
Absolutely. And do you think that's something that you see happening on the NHS in the near future?
It's challenging because the NHS has not ever been particularly good at preventative health. It's great sometimes for when you end up in the bad situation. And I think if there was more forward thinking, yes, it would be introduced, but I'm not sure we're there yet.
No.